All right, ladies and gentlemen, welcome back to the Sharpe Minds podcast. I am your host, Michael Lafata, and today we're going to go in depth on a topic that's extremely prevalent in today's society. It's prevalent for people that are planning for retirement, those in retirement, financial planners who are helping those individuals plan for those phases of life. And honestly, it's important for everybody who's employed because odds are you're paying into the Social Security system, and later in life you'll be eligible for benefits. We've had a lot of discussion around the future of Social Security recently, so definitely a topic we're gonna get into. And we have a expert on this on Social Security here with us today. Graham Kimmerer is here from MFS, and Graham, thank you so much for spending some time with us today.
Thank you, Michael. Happy to be here.
Of course, of course. Let's would love to give you a proper introduction and provide some background on you, and then we'll get into it.
Hmm.
Awesome. So you're a senior strategist with MFS Investment Management, and in your role, you work with financial advisors like myself and their clients on complex topics such as Social Security and Medicare. You've been in the industry since 2010 and with MFS since 2013. So prior to joining MFS, you were actually a financial planner with a
Mhm.
large national firm. And I'm sure that probably gives you some really good background that you can use in, the discussions that you have with clients and advisors on these
It definitely
topics.
does because it was something that was part and parcel of the conversations I had with the clients with the team that I was on, which is really what gave me kind of the foray into understanding how important both these topics were for folks heading into retirement.
Yeah, for sure. I definitely um, can understand that. And, something we'll certainly get into is we've had some recent developments take place in Social Security and some of the biggest changes that we've had, within the past 40 years.
Mhm.
Um, but let's start at a high level before we sort of get into that. And let's just discuss how the system works, how benefits are calculated. So would love to just have you, sort of get into, the basics there of the system, its structure,
Mhm.
and how that all works for individuals.
Yeah, it's not as intuitive as I think a lot of people believe it to be. It's a really odd calculation that they use. And I was going to bring up a couple slides here because I think
Sure.
visuals help because this isn't necessarily a logical path to follow. So in terms of qualifying for Social Security, getting the bare bones that you can just to get something at some point, you need to work for 40 quarters. Now, those quarters don't need to be sequential. There needs to be 40 of them put in all together that will qualify somebody to receive their own Social Security benefit. Following that, the next most important factor is having a longer earnings history. Social Security will always be looking at someone's highest 35 years of earnings. So it's not their most recent earnings years, although those can be very, very important. It's not the last 10. It's the highest 35 cherry picked throughout the course of their work history. Now, if you're thinking back to saying, you know what, 35, 40 years ago when I started my career, a dollar then doesn't look like a dollar today. And you're absolutely right. And the administration does take that into account. They use a form of inflation, and this is where things really start to get quirky. They use the average wage index from the year before someone turns 62 to adjust all of that 35 years of earnings. Now, once they've adjusted that, they look at all those 35 years and they add them all up and they get a really, really big number. Following that, then what they do is they take that number and divide it by 420. Seems like a random number, but that's called the averaged indexed monthly earnings, or AIM, or AIME is what it's sometimes referred to. Once they have that figure, there are three different, what they call bend points. I kind of think of them a little bit more like brackets that have multipliers attached to them. So this first bend point is the first $1,226 of someone's average index monthly earnings. They multiply that by 90% or zero point 0.9. They get a number. Then they take all the earnings between 1,226 and 7,391 and multiply that by 0.32 or 32%. They get that separate number. And the last endpoint is any earnings above $7,391. They then multiply that by 15% or 0.15, and they get this third number. They add these three numbers together, and that effectively is what someone's primary insurance amount, what they're going to get at their full retirement age is. So it's not as intuitive of a calculation. It's not easy. It's a little odd, but that's how they come up with the number that you see in the right-hand corner of your statement.
Yep, gotcha. And and this is so when you hit your full retirement age, um, that's the figure that you could be eligible for. But if you don't if you don't apply for benefits at your full retirement age, which is currently 67, there's a calculation for when you can receive your benefits at 62, right? Or this is built into that.
It is. So everything's built off of that full retirement age figure, that
Mm.
primary insurance amount. And then folks have different decisions. They're eligible to receive benefits starting at age 62.
Yep.
You can absolutely do that. However, there's going to be pay cuts. Basically, if you file for your benefits anytime prior to your full retirement age, they give you a pay cut in some way, shape, or form. If you're 62, that generally is going to be around a 30% pay cut, permanent pay cut that's taken off of it. On the flip side, though, if folks are willing, if they're able, if it makes sense for them to hold off beyond their full retirement age, there's an 8% step up each year up until age 70. So Social Security benefits will max out at age 70 if you're planning on taking it, but there is this guaranteed 8% step up year over year between full retirement age and age 70.
Gotcha. When you're providing advice or strategy to clients about what they should do for their benefits, do you find yourself frequently recommending that clients take their benefit at 67? Um, or is it really subjective, right?
Yeah.
Yeah, some it would work better at an earlier age. Some it might work better at a later age. Some fit right there, right in that sweet spot of 67.
Usually, the most commonly used phrase when having discussions around Social Security is "it depends."
Yeah,
And
right.
I think when it comes to taking personal benefits, this is the primary showcase for that because it depends on a lot of factors. Are you planning to continue working past full retirement age or between 62 and full retirement age? Are you married? We need to bring in your spouse's
Mhm.
or your husband, your wife's benefit into the conversation as well. Do you maybe have young children? Because that happens frequently, where sometimes by filing, they can get benefits. That's not always the best course of action, but that is another conversation. What does someone's health look like? What is their family history? What do all of their accounts look like? Because Social Security is a very important piece of a lot of people's retirement, but it needs to fit into their overall financial plan of their IRAs, their pensions, their 401ks, any other types of income that they may have. So all of these different variables go into answering what seems like it should be a relatively straightforward question of when should I file?
Gotcha. And so something at the onset of, that you said is if an individual is going to keep working.
Hmm.
How does it work if they do keep working, right? Because, especially today we're seeing people, continue to work longer, right? Whether it's a
Hmm.
part-time job or they really, really enjoy what they're doing, whatever the case might be, we don't see, in our cases, we see clients, tending to work longer than usual. So how does
Hmm.
that work?
Well, it depends.
Yeah, right,
Um,
right.
so the first thing I'll say is actually about the calculation, because this is a
Yeah,
question that comes up quite a bit, which is, okay, I'm working past my full retirement age and I'm earning a decent amount. Do they stop calculating my benefit? And the answer there is no, they're still including that. You could work until you're 115. And if any one of those years is part of your new highest 35 years, they're always going behind the scenes and recalculating somebody's benefit. Now, because it's an average over the course of 35 years, it usually doesn't have a really big outsize effect, but there will be readjustments based upon work history. Also, if there is inflation, which I know folks have felt that for the last couple of years. There are cost of living adjustments, which are oftentimes just called COLAs.
yep,
So if there is inflation, Social Security also gets adjusted to that. But there's kind of a spur conversation on this, which is what if someone decides to file for their benefits, before their full retirement age and continues working, or they decide to file for benefits because they were maybe retired early, but they have the chance to go back to work or they want to get a part-time job. And that's where it can get a little annoying and a little tricky because Social Security puts in place what they call the earnings limit or the earnings test. And there are two types of earnings limits. There's one for the duration of the first year in which someone files. So let's just say I'm 62 or 63 years old. I'm choosing to file for benefits here in March. If I earn more than a certain amount on a monthly basis between now and the end of the year, I may not get my checks. So for this year, that amount is $1,950. So if I'm really below my full retirement age, 62 through 66, basically, the earnings limits could be around $1,950 for that first year. Then the following year, it goes to an annual earnings limit. Now, I don't know exactly what the number is going to be for next year. They haven't come out with those figures. But if all things were to remain the same, that annual earnings limit is 23,400. If next year I earn anything beyond $23,400, then for every $2 I earn above that, they withhold $1 from my checks. The year that I'm officially turning my full retirement age, both of these numbers get a lot bigger. If it's the first year that I file, that earnings limit for the duration of that 1 year is a lot bigger. It's 5,180, and the annual figure is much larger. It's $62,160 for this year. And in that one specific year, if I then cross that 62,160, then they withhold $1 for every $3 that I earn above it. Once I reach my full retirement age, there is no more earnings limit. So I could file for my benefits. I could earn $1 million a year. It's going to factor into my tax situation, but I'm not going to have any penalties or withholdings. And that kind of is the key word, that this isn't a permanent penalty or a tax, really. If someone is affected by these withholdings, they do get that money paid back to them.
Gotcha. So that's a big plus to working to your full retirement age, or pardon me, not collecting until you hit your full
Hmm.
retirement age, is the fact that once you hit it, you can continue to maintain your job, earn as much as you'd like, while not taking any while not taking a hit on your
Hmm.
Social Security benefit.
That's correct. Yeah.
That's awesome. Very cool. Yeah, that can certainly, come into, financial planning. It's certainly something that we discuss frequently. And it can play a big role for an individual.
Hmm.
You also touched on spousal and survivor benefits earlier.
Hmm.
So that's something, and we can, spend, hours going into all this stuff because it really can be so complex, and so deep. But, let's dive into sort of that spousal benefit. Um, can you provide sort of a high level view of what that looks like and some of the benefits there?
Yeah, absolutely. So even if your husband or wife, your spouse, never worked and they don't have their own Social Security, they can still receive a benefit based off of your work history. And I think that there's three important factors around spousal benefits to know. The first is it's always calculated off the full retirement age amount of the person it's being based off of. So said another way, if my spouse wants to get a benefit based off of me, it's always based off of my full retirement age amount. So that my full retirement age amount is kind of like the uh, point that everything is calculated off of. Regardless if I file at 62 with reductions or if I wait until 70 and maximize, it's always pegged to my age 67 full retirement age amount. The second key thing to know is I need to file. In order for my spouse to get a benefit based off me, I need to be in receipt of my own benefit or be on Social Security disability. Either of those two are called deeming qualifications. Deeming sounds complicated. All it really means is qualifying event. In the case of a spousal benefit, that qualifying event is the primary person filing first. And the third important thing to know, and I think this is what, if anyone knows about spousal benefits, this is what it is 50%. The maximum amount a spousal benefit can be is 50% of the primary person's full retirement age benefit. However, that spouse, that second spouse, would need to wait until their own full retirement age to file to get that 50%. If they were younger, let's just say age 62, the primary person had filed and get my benefit, there's going to be a reduction. Again, you do anything before full retirement age, reduction, so it could go down to 32.5%. I think this can get tricky for a lot of folks because it could be a situation where maybe the person that wants to get the spousal benefit might have a smaller amount that they're looking to file for first, and it gets really kind of odd. And this is if you're looking at the screen, the bottom right hand side, there's a little bit of fine print that says if you claim before your full retirement age, it reduces the total amount you receive after your spouse applies. So let's just say that, me and my spouse are the same age. If she wants to go and file at 62, she's going to get a reduced amount. It goes down by 30%. And the plan is for me to keep working and I'm going to file for my benefit, let's just say at full retirement age. That's 5 years later. Now, it's great because my spouse has been collecting benefits for 5 years, but a lot of individuals believe, okay, great. My spouse applies. I'm at full retirement age. Boom, I'll get that 50%, the full spousal benefit. However, because that spouse filed for their own at 62, there's a whole different formula. It's called the excess spousal benefit. That means that it's really unlikely for that benefit at that second spouse's full retirement age to match 50%. So it's not to say that folks shouldn't do that. It's definitely a strategy that can be used. But I've had a lot of conversations where folks are expecting to get this very specific number, and it could be hundreds of dollars less because they filed for their own at age 62 or 63. I understand that there's a lot of moving parts there. It's tricky. I think the important part here is to make sure if you are married and having conversations around Social Security, bring in your statement, have your spouse bring in their statement as well. So that way you can make a really informed decision about who's filing, when are they filing, and is there going to be any other later impacts to other benefits down the line to ensure that people make a really informed decision.
And where can someone obtain a statement for
Yeah,
their?
so it's the easiest way to go about it is SSA.gov. They stopped regularly mailing out statements about
Yeah,
a dozen years ago. So SSA.gov, top right-hand corner, you can log into an account if you've already created one, or you can create an account. Takes maybe 10 or so minutes. They do have to give you a PIN number to get access to your account. Most folks find it easy just to have that PIN number texted to them or emailed to them to log in, but that's where they'll be able to see their statement. If you are married, you it may not have the benefit for your spouse directly on that statement itself, so you might need to look up their statement, your statement, and do a compare and contrast.
gotcha. And that maintains real-time data for the most part.
It does, yeah. So as soon as basically the Social Security gets all the updated information for your earnings history,
Mhm.
it gets tabulated in there.
Gotcha. And do they work with the IRS to get that data? How does
They
that
do,
work?
yep. It's the IRS, U.S.
Okay.
Treasury.
Gotcha. Okay. Awesome. Um, and then so we discussed spousal benefits. What about survivor benefits, right? There's something there as
Yeah.
well. And that can be mistaken as something very similar. And it is kind of similar, but at the same time, it also has its differentiations.
Yeah, I think you're absolutely spot on there. Survivor benefits are a separate form of benefit. A lot of times the conversation around spousal and survivor kind of gets lumped together.
Yep.
I've even had some individuals refer to survivor benefits as spousal survivor benefits. I'd ask you really just to call them survivor benefits or widower benefits because it helps focus the conversation. There have been occasions where the folks at Social Security they got a lot going on. They only hear that first word spousal, and then they give misinformation, even though they could have read between the lines, to really understand that this is a survivor benefit. And this isn't to knock the hardworking folks at Social Security. It's just that they do have an awful lot going on in terms of the information that they need to know and how they're able to kind of process everything that you're saying. So ensuring that you can kind of speak Social Security's language ensures that you're going to get the right information so you can make the right choice. But survivor benefits are based off of what the person who passed away was either receiving or what they should have been due. So I'll start with that first part, the receiving part. That meant they had the chance to file. So that is unlike spousal benefits. With spousal benefits, it was always tied to age 67 or full retirement age. With survivor benefits, it's tied into what that individual was getting. So if they filed at 62, they took a reduction. The survivor benefit is based off of that reduced figure. If they waited until 70 and maximized their benefit, the survivor benefit's calculated off that increased figure. So if someone was receiving a benefit or they were on Social Security disability, it's based upon the amount that they were receiving. If they didn't get the chance to file, that can go one of two ways. If the person who passes was younger than full retirement age, they basically give them the benefit of the doubt. It's based off that full retirement age number. But if they were between full retirement age and age 70, and someone passed away in between without having filed, they treat it basically as if someone passed or they filed the day that they passed away. So if they passed away at 68 and 2 months, it locks into that point. It doesn't revert back to full retirement age, but they don't, spread it out to age 70. After that, survivors, if folks are in this situation, have some options available for them. If you look at the screen here, you can see these charts. You can start with a survivor benefit at age 60. So that's before personal benefits, before spousal benefits. But again, there's a pay cut.
Right,
So at
right.
60, it would be 71.5% of what the deceased was either receiving or what they should have been able to get. And I do really think that survivors have options available to them. They have what's referred to as widow or widower switch up options. So someone could start with a survivor benefit at 60 and then hold off taking their own until it makes more sense for them. That could be at age 62, it could be full retirement age. They can wait until age 70, maximize their own benefit, taking the survivor benefit all along the way. Or they could start with their own benefit at 62 and then switch over to the survivor benefit between then and their full retirement age. And one bit of bad news is the earnings limits we talked about before. They apply to all types of benefits. So that's personal, spousal, and also survivor benefits.
Gotcha. So even if a survivor is still working, let's say when their spouse passes away, they still fall under those same guidelines of, if you're younger than 67, you're still going to get hit with deductions, for every dollar above the limit that you're at.
Exactly. The same earnings limits that we talked about before. If someone takes a benefit at 60 or 63 or 64, it's still going to impact them, unfortunately.
Gotcha. Okay. And they also have to worry about taxes with Social Security too, because
They
that's
do.
not something, you know, when I think about this often, right, we're talking about those earnings limits and dollars getting reduced from your benefit. Sometimes in my initial thoughts, it can get mixed up as sort of a tax,
hmm
but they're not. They're completely separate. You could have taxes are their own thing when it comes to Social Security, and they're treated completely different than that earnings limit that we're referring to.
Yeah. So right now, Social Security, when you take it federally, it becomes taxable. Depending on the state that you're in, your state may choose not to tax it, partially tax it, or fully tax it kind of at their regular state limits. But in terms of the federal limit, there's another odd calculation here. It's referred to as either combined income or provisional income. It goes by the same name. What combined or provisional income is the combination of someone's adjusted gross income, any non-taxable interest that they have, plus half, just half, of someone's Social Security. That's equals the combined income calculation. Then they have different, again, I'm going to refer to these as brackets because I think it's
Yeah.
easier to talk about them that way. Different brackets that they use to determine how much of your Social Security then gets included into your tax picture. So there's a bunch of different ones. I think the one that comes up the most often is if you're married filing jointly, if your combined income is above $44,000. At that point, they're going to include up to 85% of your Social Security as part of your taxable picture. So they're not taxing it at an 85% rate. Sometimes it gets read that way. I'm very happy to report that that is not the case. They're able to include up to 85% of it into your taxable picture. And there are a number of things that are excluded, items that are excluded from combined income. If you're on the screen, the six that pop up the most common are Roth IRAs or 401ks, life insurance proceeds, qualified charitable distributions, inheritance and gifts, non-taxable portions of pensions and annuities, and HSAs, health savings accounts, any withdrawals from them for qualified medical expenses. So that's not the full list, but those are the six that pop up the most often.
Gotcha. Gotcha. So when you say non-taxable income, that could be, municipal bond income or
That's
something very
correct.
similar to that.
Yep.
Um, It's very interesting that that is counted as income for Social Security tax purposes, but not federally.
Yeah, it is. It's definitely a bit of a quirky bit of the calculation.
Yeah, yeah, very interesting. Awesome. So I mentioned at the onset about the recent change that has taken place and how it's, one of the biggest, if not the biggest, that we've seen in, many, many decades.
Hmm.
And that refers to the windfall elimination provision and the government pension offset. There was a lot that just took place within this. Um, I'm and you're going to be do a great job of sort of unwinding the whole thing. And sort of just let you go, sort of do that, right? There's a lot here. It impacts a lot of people. Um, and just would love to hear your thoughts here and what changes were implemented.
Yeah, so this is, like you mentioned, one of the biggest, if not the biggest, changes to Social Security legislation changes that's occurred in probably 40 plus years.
Yeah.
That's the passage of the Social Security Fairness Act. Congress put that through at the end of 2024. It was signed into law officially at the beginning of January 2025. And what it removed from Social Security was two aspects called either the windfall elimination provision, WEP or WEP, and then the government pension offset, GPO. What these were was effects to Social Security for individuals that worked what were referred to as non-covered pensions. So non-covered is the technical term for meaning that they did not pay into Social Security, they did not pay Social Security taxes while earning a pension. Most of the time, this was going to be government employees in some capacity. Oftentimes, it was going to be educators, so teachers and even folks maybe part of state university or college systems, firefighters, police officers, first responders, some municipal employees, as well as workers that are in the federal government as part of the Civil Service Retirement System, or SERS. The federal government has two different types of pension systems. There's SERS, CSRS, Civil Service Retirement System, and then FERS, FERS, Federal Employees Retirement System. Anyone that was in the civil service retirement system, they could have been, or they were going to be impacted definitely by a windfall elimination provision. A small group would have been impacted by just windfall elimination provision. Um, and then if folks were in FERS, the Federal Employees Retirement System, they were never going to be impacted by these benefits. So this usually falls into folks that were hired 1984 or before. By and large, they were going to be impacted by both WEP and GPO. Folks that were hired afterwards were most likely in FERS and they were never going to be impacted at all. Um, but what this really was the ability to receive Social Security in addition to that government pension. The windfall elimination provision was for individuals that earned their own Social Security in some capacity. So let's just say that I worked for 40 quarters, I earned my Social Security, and then I spent the rest of my career as a teacher. So previously, if I had gone onto the Social Security website and looked at my statement and it said I was due a certain amount, that wasn't totally accurate because they weren't yet taking into account this one-fall elimination provision reduction. So it would have reduced my ability to draw my own Social Security. Sometimes this brought it down to a very small figure. On the flip side, though, there was what's called the government pension offset or GPO. A lot of individuals that had these non-covered pensions either had very small Social Security benefits or maybe none at all because they spent their entire career in these non-covered positions. So they said, okay, I don't have anything on my own. I don't get anything, but I'm going to take a spousal benefit off of my husband or wife, and should or when they pass, I can receive a survivor benefit. The calculation for government pension offset was two-thirds. Two-thirds of whatever that government pension was, they subtracted from that expected spousal or survivor benefit. So this oftentimes completely erased either a spousal or survivor benefit or substantially reduced it. Now, as of the beginning of this year, neither of these two things exist anymore. So anyone that was receiving reduced personal benefits due to WEP, They're going to get a new increased benefit starting, they say, by the end of April, and they can get up to 12 months of benefits in. When they put through this legislation, they backdated it to January 1st of 2024. So if this has been affecting me for 10 years, let's just say, I'm going to get a new unreduced amount moving forward and all of 2024 in benefits in arrears lump sum. Now, this can be tricky as well, though, because there's a lot of individuals who may be receiving uh, just maybe their windfall elimination provision reduction, but they could be due something like a survivor benefit. They proactively need to change that. They need to say, I want to stop getting my own and go to a survivor benefit. If you were getting your own, but now there's a spousal benefit that's available for you, that should happen automatically, but I would check those increased amounts and make sure that the math makes sense. So review statements just to make sure that everything is moving smoothly. And there's a lot of individuals that just never filed for benefits. If I never worked in the private sector, I never earned my own benefit, and I had a relatively large pension, I may have never tried to apply for a spousal or a survivor benefit. For folks that are in their late 60s, their 70s, their 80s, or older, they can now receive these brand new benefits. So I definitely ask them if they know that this is something that had affected them and now it doesn't, they're going to want to contact Social Security soon, file to get their new benefits, and if they're older than full retirement age, they can then ask Social Security to backdate their filing by 6 months. So that means they can get 6 months lump sum in addition to a brand new benefit moving forward. This isn't doesn't does not affect all government employees. So there's about a dozen or so states that this impacted primarily. Massachusetts, Maine, Rhode Island, Texas, California, Colorado, just to name a few. So if you happen to work in, let's just say, New York State and you're a teacher, you probably paid into Social Security. If you're a federal employee, it goes to that SIRS or FERS situation. But if you have any questions or kind of any considerations around this, check your statement. If it's a healthy figure, you're probably paid into Social Security. If you're still working, check your pay stubs. You'll be able to see that you're paying your FICA taxes, paying your Social Security. So that way you know that this wouldn't have affected you to begin with. I recognize again a lot of information in a brief period of time. This had the most moving parts to it for a lot of the conversations I had when it existed. And I think there's going to be a massive amount of confusion for at least the next year or so as folks understand what their benefits are going to be moving forward. So please, again, check your statements, check your spouse's statements, and keep an eye on your deposits from Social Security to make sure that the numbers are in line with your new expectations.
So those new payments that individuals could be eligible to receive, can you sort of draw a line between, the individuals that might have to take action to receive those benefits and those who don't, right? So, for example, is there a group of or a subset of individuals in this, category that are just going to have their benefits automatically calculated or recalculated?
Yeah.
Um, or is there a group that's going to have to reach out to Social Security and say, "Hey, I know I should be getting an adjusted benefit.
Mhm.
Can we take care of that?"
The folks that I'm going to address that second group first because I think
Sure.
those are the folks that really need to take action, which is folks that never filed for any benefits because the government pension offset completely erased any potential that they had. So this could be a spousal benefit, it could be a survivor benefit. They're now entitled to both of those. So folks that are in their late 60s, 70s, or older who had never received any benefit off of a husband or a wife because of government pension offset, they're going to want to contact Social Security, work with a financial professional, in order to make sure they get their benefits started as soon as is practical, as well as potentially doing that 6 month backdating. The folks that should have this automatically taken care of are individuals that were already receiving either a personal or a spousal benefit. So if you were already receiving a personal benefit, it should increase to a new unreduced personal amount. And on paper, it should then automatically change to a spousal benefit if that's now higher as well. I just want to make sure that everything happens smoothly. So if someone's going from a personal benefit, but they know that a spousal benefit is actually bigger, I definitely suggest that they take a look at their increased amount when it does happen to make sure it matches up. So again, a statement review there is extremely helpful. For folks that were receiving uh, personal benefits, but now are eligible for survivor benefits, that doesn't happen automatically. Again, GPO, that two-thirds calculation was big. It completely erased a lot of these benefits. So sometimes you would have had a folk that did, an individual that did spend some time in the private sector. So they said, okay, I'm going to get a couple $100s a month from my WEP reduced amount. If their spouse had passed away, they still weren't able to take advantage of that survivor benefit. So, yes, they're going to get an increased personal amount, but Social Security will never proactively force you to take a survivor benefit. Individuals need to reach out and amend their applications for that.
Gotcha. So that I would assume, so like a spousal benefit that, let's say, a wife is receiving a spousal benefit from her
Mhm.
husband who worked, and she didn't work. If he falls into, the category of his benefits will be automatically updated. Hers
Mhm.
should as well.
Yes. Yep.
Okay, awesome. What prompted, I know this is part of the Social Security Fairness Act of 2024, but do you know what prompted this change? Or prompted the,
Basically,
yeah.
since these came out in the late 70s and early 80s, they have been very unpopular, and there have been waves of efforts to repeal them in the past that effectively went nowhere. But in the fall of last year, we started to see a groundswell of support to change or alter this. So, what this does prove to me is that Congress is completely capable of making major legislative changes to Social Security when they feel empowered to do so.
Yeah. I think, that definitely blends itself into the conversation of, what are some of the things that could take place um, to ensure the viability of Social Security down the road,
Yeah,
right?
I
And
mean,
that's something we can certainly dive into now, um, because that's a topic that's everybody's been discussing is the solvency
mhm.
of Social Security for I think it's 2020 2035 is when they're saying the benefits could start to be reduced. Um, so that's definitely been on top of people's minds.
Yeah, it's likely the number one question that gets asked when I do public events.
Hmm.
People are always asking, what's kind of the future of Social Security look like? And that insolvency date has bounced around. It changes a little bit every year depending on, the workforce, people taking money out of Social Security versus getting
Hmm.
paid in. So it usually bounces around into from the early to late 2030s. What this does mean is sometime in the next 8+ years, um, Social Security does have some funding issues. When you see these headlines that say Social Security is insolvent or runs out of money or goes bankrupt, I think that's a bit misleading because it's not all of Social Security.
Right,
Social
right.
Security, as long as people are paying their Social Security taxes, money is going to be going into it. Basically, what happens is the rainy day amount of money that Social Security has, that's when that runs dry. And for a long time they've been tapping into kind of this rainy day fund in order to meet the outflows of Social Security. So there's more money coming out of Social Security than there is going in. Um, Depending on the year, the estimates have ranged usually between 75 cents to 80 cents of every future dollar can be paid directly through payroll. That's what they're projecting.
Mhm.
So Social Security again will never run completely out of money. But worst case scenario is 75 to 80 cents, which I know isn't great.
Mhm.
So what can Congress do to help out Social Security? I think there's a number of things that could be on the table. I think that there's a chance that they might increase the full retirement age. In the early 80s, when they made the last really big legislative overhaul to Social Security, that's what they did. They made anyone born 1960 or afterwards full retirement age 67. So they could do something very similar for a different age group. They could change what's called the tax max. We didn't get the chance to talk about this when we were talking about the calculation of Social Security, but there's an amount this year, it's around $178,000, where we all pay and fund Social Security up until that amount. Once you cross that, you'll still pay your Medicare taxes, but you're no longer funding Social Security. So people earning 200, 500, $1 million a year, they're still paying the exact same amount of Social Security as someone that just pays 178,000. So they could change that. They could up it substantially. They could uh, have it uncapped altogether, which is the way that it is for Medicare, and maybe alter those bend points that we talked about before, so they could change the calculation. There's been some conversations around changing how Social Security gets taxed, both on the personal and the kind of the employer side. So I think there's a number of different things that could be on the table, but ultimately it's for Congress to decide, and we're definitely paying a close attention to what they're thinking and doing over the course of the next couple of years. Like I said, I hope they do feel empowered to make some changes before this gets to the 23rd hour, because I know that there's a lot of individuals out there that want some clarity, so that way they can make an informed decision. One thing and this is going to be my 2 cents, what I believe is that when they do make these changes, anyone that's already on Social Security, as well as people that are going to be taking it within a certain window of time. I don't know what that window of time is going to be, but they're basically going to be in a protected class where Social Security is going to look and feel the exact same way as it does now, as it will for them moving forward. And then it will be altered and adjusted for people taking at a certain point down the line. So I hope this gives folks that are listening a little bit of confidence to make sure they're taking Social Security at the right time for them and their family, not just because of what they see online.
Gotcha. So you and I will be affected by this.
Probably, yeah.
Yeah, yeah. That's funny. And that brings us to another topic that I want to touch on. As people can see, there's so many different avenues that you can go down. There's so many different, moving parts here. So many different things in life can take place that could affect, what the decision that you make here. What are some of the uninformed decisions that people make when they start collecting or when they hit, the age where they're eligible to start collecting their benefits?
Yeah, I think what happens often is folks read about a strategy online and it sounds good. They talk to their family, their friends, and that person decided to pursue a certain course of action, and they decide to say, hey, that sounds really good, I'd like to do that too, not realizing that everybody's situations when it comes to Social Security is very separate and unique. I think that what I just want to make sure that if you take nothing away from the conversation that we've had here,
Yeah.
it's about making informed decisions.
Yep.
Most individuals have two or three viable options for them. Sometimes one is so obvious that that's definitely the path that you should pursue, but most often there's going to be two or three that really work kind of in the context of someone's overall financial plan. And it's about having a conversation and weighing the different pros and cons. It's not always about always maximizing benefits. It's about striking the right balance for you, your family, and your financial situation. Um, I think another very unintended mistake is that earnings limit that we talked about before. Folks say, I'm 62, great, I get to take my benefit, but they continue working and then they never get a check, or Social Security doesn't even allow them to file. And they say, what gives? It's because of that earnings limit that causes a lot of frustration. Um, so it's really just about making sure that everybody that's out there looks at their statements, reviews the situation with their spouse, and again, just kind of make sure that it's part and parcel of the overall financial plan, that it's
Mhm.
not just a separate decision that gets made outside of those conversations.
Gotcha. Awesome. Um, when we think about, I know we've touched on, individuals with higher incomes a couple times.
Hmm.
Um, you also are very knowledgeable in the space of Medicare.
Hmm.
How can, um, an individual who is wealthier, who, has a pretty high income, what are some of the, negative effects, when it comes to Medicare that, could, I don't want to say negative effects. What are some of the things that they could run into, that they
Yeah.
need to be cognizant of?
So like you mentioned before, we could wax poetic about Social Security and Medicare for hours.
Right.
I am not going to do that to you and all your listeners. Um, but I think what catches a lot of higher net worth or higher earnings individuals as they approach retirement when it comes to Medicare are the Medicare Part B premiums. Original Medicare, what's offered officially from the US government is two pieces. Part A, which is usually referred to as hospital insurance, which is free for most individuals out there. And then Part B, which is outpatient or doctor's insurance. Part B, there will be premium people have to pay once they file for it. For this year, these premiums start at $185, but they can increase to nearly $629. And this is called an IRMA. IRMA stands for Income Related Monthly Adjustment Amount. And although it sounds like someone's friendly Aunt Irma, it isn't. It can be costly and it takes a lot of people by surprise. The reason why it's surprising is that these premiums are based off of someone's modified adjusted gross income and tax filing status from 2 years earlier. So let's just say that I'm age 65. I'm choosing to retire and enroll in Medicare. They're looking at my modified adjusted gross income and tax filing status from when I was 63 to determine these premiums. A lot of folks, as they approach retirement, are in their highest earnings years. And the plan is once they're into retirement, there could be a little bit of an income adjustment that's there. So a lot of folks may find themselves initially in a higher IRMA bracket or higher IRMA premium when they enroll in Medicare. However, they don't necessarily need to eat that cost. There's a form that's available from the Social Security Administration called SSA 44. So it's SSA, like the Social Security Administration, dash 44, which is for individuals that have life-changing events. What's called a work stoppage or reduction is one of the most often used ones. I think we can just call that retirement. So basically, if an individual knows that their modified adjusted gross income moving forward in retirement is different than it was prior to, they can petition Medicare to lower these premiums to the more appropriate level. Now they need to do that first year as well as the second year. It doesn't want doing it once doesn't take care of it for both years, but they can make sure that they have the right premium to start. This can also catch a lot of people by surprise down the line as well, because let's just say that someone decides to downsize a primary residence. Gets a decent amount for it because home prices have definitely increased in value recently, and it's outside the excluded value. The proceeds from that sale can catch up 2 years later. The sale of a vacation home, family land. I think the most unique circumstance I had was an advisor had a client who inherited his grandfather's collection of antique tractors. He sold it to a collector, got a lot of money for it. 2 years later, he went from the lowest premium to the highest because that's when the sale of those collectibles hit his modified adjusted gross income. If folks are doing Roth conversions, this can also take effect. The form that I mentioned does not take care of those one-time windfall-like events. 2 years later, that increase will spike their Part B premiums. So I think this is an important conversation for a lot of high net worth folks to have as they're leading up to and even into retirement. I don't want people just doing Roth conversions for fun, but if you do them more than 2 years, if it makes sense, more than 2 years before you enroll in Medicare, you won't possibly have that increased IRMA premium. Or if folks have been considering selling a major asset, at least planning for what the knock-on effects could be 2 years later is important, or doing it more than 2 years before you apply for Part B. If folks are charitably inclined and they're into their 70s, if you're funding some of your favorite organizations, rather than just cutting them a check, you could do a qualified charitable distribution from your IRAs. If it happens to put you below one of these brackets, it saves you some money on your Part B premiums, and you still get to fund some of your favorite organizations. So I think there's a lot of conversations high net worth folks would want to have with a financial professional in order to make sure that they understand the overall costs for healthcare. Because we're just touching on the Part B premiums, but healthcare is a big expense for a lot of individuals in retirement. But there's a lot of planning that can be done around this, potentially kind of heading a lot of this off at the pass to make sure it doesn't have these outsized effects on a lot of people's Part B premiums.
Yeah, it can certainly throw a wrench in things and make planning more difficult. Um, these monthly Part B premiums, do those increase at a specified rate, or how does
Mm.
are they sort of set in stone? Do they sort of have their own COLA adjustment? How does that work?
Yeah. So because this is Part B is insurance, it's based upon kind of the market usage. So
Yep.
Medicare will look at their costs on a year, and and make the adjustments based upon that. When you look at this, um, this is still kind of an offset from the actual cost from the government. So if you're in the highest IRMA bracket, that still only represents about 85% of what the actual Part B cost would be. So basically, folks that have lower modified adjusted gross incomes and joint filing tax status, or what their tax status may be, pay kind of the less of the overall burden of these Part B premiums. So it gets adjusted based upon the costs to Medicare, which means on paper, they can go down. That happens
Right.
very rarely, but they can go down. They could stay static, or they do increase year over year. Sometimes they're relatively large increases, sometimes not so much. Just as an example, last year that base premium went up around $9 per month. So $9 is $9. It's not a small amount, but it's not like these increase by substantial large amounts year over year.
Gotcha. Makes total sense. Um, One thing I was just thinking of, and would like to,
Mhm,
backtrack to what we were previously discussing. When planning for, when you're going to take a benefit in the future or doing a retirement plan
mhm,
or, whatever the circumstance might be, considering the current worries around payment of benefits, years down the road,
mhm.
what do you recommend individuals plan on, right? If you're doing a financial plan, should we plan on an individual collecting their full benefit? Should we plan on maybe 80% of that benefit being
Mhm.
paid? How do you think about that?
Yeah, I've worked with a lot of financial advisors over the last 10 years that I've been talking about Social Security, and I think a lot of them handle this slightly differently.
Hmm.
Um, we don't know what we don't know. So it's always really hard to try to game plan this. But I would say for folks that are planning on taking benefits soonish, work according to the information that we have. I have had some advisors that choose to discount Social Security in some capacity. Some of them use the government kind of stated amount. They use that 75 to 80 cents of every future dollar. I've had some that have kind of cut it in half. I've had some advisors that go really drastic and they take Social Security completely out of the conversations that they're having with their clients and say if Social Security is there 30, 40 years down the line, great. It just kind of gravy on top of your financial plan, but I want to make sure that you're going to have the lifestyle that you want based upon the things that we can absolutely kind of control and work towards. So it's really hard for me to say. I try to work within the information that I have available, and I leave it at the discretion of the advisors that I work with and their understanding of their clients to kind of plan around that in a way that works for the clients as well.
Yeah,
So
it's
I'm sorry that's not a total answer, but I hope it gives a variety of answers depending on people's viewpoints.
no, I think it sort of sums up the conversation that we've had, that that everything is subjective, and everybody's situation really is unique, right? It's a complex um it's a complex planning process. It's a complex collection process when you go to collect your benefits. So understanding the best path for you is super important, and all the options available out there are understanding all of that stuff is super important. Um, so, and we could keep going, and there's so many different things that we could discuss, but I think we've covered a lot of stuff, and it's been a pleasure to speak with you, Graham. So thank you so much for taking the time.
It's been an absolute pleasure here too. Thank you so much for having me on.
Of course, of course. When we have some more developments in the space, we'll have to reconvene and discuss that, because I'm sure as time goes with some of the stuff that we have discussed today, we're going to see more developments take place. We're going to see more
Mhm.
changes come, and it's definitely going to be a hot button for a lot of people out there. So, awesome, man. Thank you so much. It's been a pleasure speaking with you. And thank you everybody for tuning in, and we'll see you next time. Take care.
Sharpe Minds is produced and hosted by Michael LaFata and directed and edited by Alex Weimer. Our music is made by Tony Sapiato and licensed through Soundstripe. Michael LaFata, Financial Advisor, Archstone Financial, 508-453-9800, 324 Grove Street, Worcester, Massachusetts, 01605. Securities and advisory services are offered through Cetera Advisor Networks LLC, member FINRA, SIPC, a broker, dealer, and registered investment advisor. Cetera is under separate ownership from any other named entity. Archstone Financial is not a subsidiary nor controlled by Cetera Wealth Partners. The views stated in this podcast are not necessarily the opinion of Cetera Advisor Networks LLC and should not be construed directly or indirectly as an offer to buy or sell any securities mentioned herein. Due to volatility within the markets mentioned, opinions are subject to change without notice. Information is based on sources believed to be reliable. However, their accuracy or completeness cannot be guaranteed. Past performance does not guarantee future results. The guest speaker interviewed in this podcast is not affiliated with or registered with Cetera Advisor Networks LLC. Any information provided by them is in no way related to Cetera Advisor Networks LLC or its registered representatives.